What is the purpose of sterile gloves in medical procedures? A. To keep hands warm. B. To provide extra grip. C. To prevent the spread of infections to patients. D. To enhance dexterity. What is the purpose of the Glasgow Coma Scale? A. To measure patients' intelligence. B. To assess patients' pain levels. C. To evaluate patients' mental status and level of consciousness. D. To determine patients' blood pressure. Which medical professional is responsible for administering anesthesia during surgery? A. Surgeon. B. Radiologist. C. Anesthesiologist. D. Pathologist. Which of the following is a sign of respiratory distress? A. Decreased heart rate. B. Pale skin. C. Low blood pressure. D. Rapid breathing. In which of the following is a lumbar puncture most likely to occur? A. At the level of L3 to 4. B. At the level L1 to 2. C. At the level of C6 to 7. D. At the level of S1 to 2. A patient is getting a head CAT scan. The patient experiences nausea and respiratory difficulties after receiving a contrast injection. Which kind of shock is the patient going through? A. Anaphylactic. B. Cardiogenic. C. Neurogenic. The major role of X-ray beam filtration is to A. Reduce patient skin dose. B. Reduce image noise. C. Reduce scattered radiation. D. Reduce operator dose. Increased tactile fremitus is noted in the patient's right lower lobe. Which of the following conditions would explain this? A. Pneumothorax. B. Pneumonia. C. Pleural effusion. D. COPD. Palpation of the patient's trachea reveals a tracheal shift to the right side. Which of the following would most likely cause this finding? A. Right side atelectasis. B. Right side pneumothorax. C. Right side pleural effusion. D. Left side pneumonia. A patient with multiple right-sided rib fractures would present with which the following findings? A. Dull percussion on right side. B. Seesaw chest movement. C. Symmetrical chest expansion. D. Flail chest. Auscultation of a patient's lungs reveals coarse bilateral crackles. This is most likely due to A. Secretions. B. Pulmonary edema. C. Pulmonary fibrosis. D. Atelectasis. Auscultation of a 3-year-old child's lungs reveals unilateral wheezing. This patient most likely has A. Asthma. B. Secretions in the airway. C. Foreign body airway obstruction. D. Pneumonia. Increased accessory muscle use is most often due to A. Hyperventilation. B. Increased airway resistance. C. Increased lung compliance. D. Poor cardiac output. Auscultation and percussion of a hemodynamically unstable patient's left lung reveals distant breath sounds and hyperresonance. The respiratory therapist suspects a pneumothorax. What should the therapist recommend next? A. Obtain an ABG. B. Order a chest X-ray. C. Needle decompression. Following endotracheal intubation, chest assessment reveals breath sounds on the left side are distant and resonant to percussion. This is most likely due to A. Right mainstem intubation. B. Left side pneumothorax. C. Large pleural effusion. D. Esophageal intubation. While auscultating voice sounds, the therapist hears the softest sound, or ah, when the patient says the letter E. This change in sound is associated with which of the following conditions? A. Pneumothorax. B. Pneumonia. C. Pulmonary edema. A patient receiving mechanical ventilation has distant breath sounds on the left side with a tracheal shift to the right. The therapist should suspect A. Right mainstem intubation. B. Left side pneumothorax. C. Left upper lobe pneumonia. D. Pulmonary embolus. A patient receiving mechanical ventilation has increased peak inspiratory pressure, coarse breath sounds, and a fever of 102.3. What should the respiratory therapist recommend? A. Chest physiotherapy. B. Spontaneous breathing trials. C. Sputum sample and gram stain. D. Increase PIP. A 52-year-old post-operative cholecystectomy patient's breath sounds become more coarse upon completion of postural drainage with percussion. The respiratory therapist should recommend A. Continuing the therapy until breath sounds improve. B. Administering Dornase alpha. C. Deep breathing and coughing to clear secretions. What do bronchial breath sounds heard over the lung periphery indicate? A. Pneumonia. B. Congested heart failure. C. Asthma. D. Guillain-Barré. You obtain a blood gas sample from the patient's radial artery and apply pressure to the site for 10 minutes. After removing any excess air from the syringe, the next step for proper handling of the blood sample is A. Adding liquid heparin to the sample. B. Placing the syringe in an ice bath. C. Applying a pressure bandage. Which of the following supply pressures would be appropriate for an air-oxygen proportioner? A. 30 psi. B. 50 psi. C. 100 psi. D. 760 psi. Which of the following values for arterial carbon dioxide tension is consistent with significant alveolar hypoventilation? A. 30 torr. B. 80 torr. C. 50 torr. D. 20 torr. You just extubated your patient and noticed immediately post-extubation he presents with mild stridor. This finding is most often associated with A. Lower airway obstruction. B. Secretions in the large airways. C. Upper airway obstruction. D. Bronchial spasm. An 11-year-old patient in the ED complains of dyspnea, chest tightness, and loose productive cough. The patient has a respiratory rate of 33 breaths a minute and bilateral wheezing in the lungs. What treatment should the respiratory therapist initiate? A. Levolbuterol. B. Oxygen. C. Salmeterol. A patient who is suspected of having a flail chest has been intubated and mechanically ventilated with PEEP therapy. The patient has just received pancuronium bromide. Which ventilator alarms would be most important to set correctly for this patient? A. Peak pressure alarm. B. Low peak pressure alarm. C. I-E ratio alarm. Fine crackles are commonly associated with which of the following conditions? A. Bronchitis. B. Pulmonary edema. C. Pneumonia. D. Foreign body aspiration. During bedside monitoring, the respiratory therapist notices a dampened waveform on the arterial line graphic. To restore the graphic to normal, the therapist should first A. Verify the position of the transducer. B. Check the transducer dome for air bubbles. C. Flush the catheter with heparin solution. D. Attempt to draw blood from the arterial line. You have a stable patient who has been admitted for pneumonia. What is the important data to review on arrival to the floor? A. Orders. B. Lab work. C. Chest X-ray. D. Pulse oximetry. You are performing a clinical assessment on a patient. You have placed your hands on each side of the patient's chest wall. You feel bubbling beneath your hands. What is this called? A. Tactile fremitus. B. Tactile rhonchi. C. Crepitus. A patient comes into the ER with shortness of breath. What initial tests would not benefit this patient most? A. Pulse oximetry. B. Cardiac monitor. C. CXR. D. Breath sounds. A patient arrives in the emergency room with chest pain and shortness of breath. What questions are important to ask at this time? A. Past medical history. B. Current medical history. C. Smoking history. D. All the above. A 2-year-old child is brought to an urgent care and diagnosed with epiglottitis. What symptoms were presented to get this diagnosis? A. Upper airway stridor. B. Fever. C. Dyspnea. D. All of the above. You have a patient in sinus bradycardia. What are the 2 treatments you will choose for this patient initially? A. Lidocaine and pacemaker. B. oxygen and atropine. C. Oxygen and digoxin. D. Pacemaker and Inderal. You have a patient with a pulmonary embolism. What diagnostic study is preferred? A. Spiral helical CT. B. Angiogram. C. VQ scan. D. CXR. What values in pulmonary testing results will be higher than normal predicted values in obstructive lung disease? A. VT, RV, of. B. FRC, RV and TLC. C. VC, RV, TLC. D. FRC, TLV, RV. What is the best method to confirm tube placement? A. Breath sounds. B. Capnography. C. Bilateral chest expansion. D. Oximetry. Your patient has an ABG of pH 7.21, PCO2 56 mm of mercury, HCO3 23 milliequivalent L. What does the ABG demonstrate? A. Uncompensated metabolic acidosis. B. Uncompensated respiratory acidosis. C. Partially compensated metabolic acidosis. D. Partially compensated respiratory acidosis. Your patient has an ABG of pH 7.21, PCO2 56 mm of mercury, HCO3 23 milliequivalent L. What does the ABG demonstrate? A. Uncompensated metabolic acidosis. B. Uncompensated respiratory acidosis. C. Partially compensated metabolic acidosis. D. Partially compensated respiratory acidosis. When weaning the patient from the ventilator, what parameters do you lower first? A. PEEP and FiO2. B. FiO2 and pressure support. C. PEEP and VT. D. FiO2 and VT. How do you calculate compliance? A. Compliance equals change in pressure, change in flow. B. Compliance equals change in volume, change in flow. C. Compliance equals change in volume, change in pressure. D. Compliance equals change in pressure, change in volume. Which of the following is not used to describe auto-PEP? A. Inadvertent PEEP. B. Occult PEEP. C. Breath stacking. D. Stiff lung. How do you fix auto-PEEP? A. Increase the I time, give bronchodilator. B. Suction airway and increase flow rate to decrease I time. C. Decrease E time and change to a square waveform. D. Decrease PEEP. How does PEEP adversely affect the body? A. Decrease of cardiac output and urine output. B. Decrease of lung volumes. C. Increase of blood pressure. D. Increases FiO2. If your patient is on a ventilator and the FiO2 is over 60%, but the patient remains hypoxic, what can you do? A. Increase the PEEP gradually. B. Increase the tidal volume. C. Increase the FiO2. D. Change the circuit. As dynamic compliance can vary at any point, what are 3 main reasons that dynamic compliance may be continually affected? A. Hyperventilation, water in tube, too long a circuit. B. Bronchoconstriction, kinked ETT, secretions. C. Secretions, FiO2 too high, PEEP too low. D. Atelectasis, coughing, sneezing. You have a patient who has a brain injury. It is important to keep the airway pressures low to avoid increased intracranial pressures. What is the best action to take? A. Keep RR high, PIP below 30 cmH20. B. Keep FiO2. C. Keep PIP over 40 cmH2O and POW2 over 60%.